Welcome back, everybody, to the Fit Nerdy channel. Uh, as with any of these videos, I am not a doctor. This is not medical advice. Do these kinds of things under the consultation of your own doctor. So, this is month one and a half update of my log with HCG, which I am administering at 250 IUs per Monday, Wednesday, Friday. Subcutaneously because it is an injectable. So that is my protocol that I have been using. I'm going to go over the blood work. I'm going to go over, pre and a month and a half in. And, well, actually about a month in is when I got the blood work done, but this is a month and a half update anyway. And then got to go into how I'm feeling. Have things started improving, and I'm having less post-finasteride syndrome symptoms. Spoiler alert, yes. Then from there, wrap everything up. So, without further ado, let us start with the blood work. So, if you take a look, this is my pre-blood work right now. Everything in general is in pretty good shape. White blood cell count, red blood cell count is in okay range. Decent range, not on the low end, which is good. Bun creatinine is always, urine nitrogen creatinine are always high for me, so this is of no concern to me personally. AST, LT, ALT are a little bit elevated, but not out of range. And then in general, for me, my cholesterol numbers have always been good. So as you can see, I was already in good health, and I was still having post-finasteride syndrome symptoms. And then going down into the testosterone and everything like that, which is really what a lot of people are going to be looking at. As you can see, my total T is 537. Not much of a change from my previous blood work. I've been hovering around 550 for the past year or so. And they say my free T is low, but they also have elevated ranges, and this was done at a TRT clinic because I know that they would give more comprehensive breakdowns of my labs, so that's why I went with them to get more comprehensive labs. And you can also see my thyroid's in pretty decent shape. There's nothing that's really out of range there or out of whack. My SHBG is on the high end, like it has been for a long time. It used to be as high as 75. So, the fact that I got it down to 53 through boron supplementation makes me happy because that means I have more free T. My estrogen numbers are relatively normal as far as I know. And, the only thing that's high really is vitamin D, and that's because I supplemented vitamin D, and I've cut back on how much I'm supplementing, so this should probably fall back into the normal range now. But my vitamin D used to be 30, which is why I started supplementing vitamin D. So good to see that through vitamin D supplementation, my vitamin D levels went up. Well, I mean, technically it's under the toxicity number, but I should be good now. And my FSH and LH are within regular ranges as far as I know. No one's told me if 4 is low. I don't think it is. And then my estrone, then on top of that, as far as I know, is fine. So overall, good blood work. And then I'm going to show you my blood work now, or the blood work I got recently. You'll see my FSH and LH are lower than they were before. Not surprised. HCG is an LH mimic, so it's going to drop my LH, but my FSH is still going, so that means that I have not shut down my pituitary, which is good stuff. My total testosterone has gone up about 100 points, so around 20-ish%. My free T technically went down, but that I didn't get the greatest sleep that day, so I'm not surprised. Then my SHBG has stayed about the same as it was before. And then the rest of my labs look relatively normal. Same, bun creatinine ratio being high, but all my other labs are within normal range. And the only thing that I will note that my red blood count went up a little bit. I'm assuming that's from the higher testosterone. And I'm pretty certain my estrogen has gone up. And I'll explain why. But this is my total number. Unfortunately, it's not as comprehensive as the other labs blood work, but doing with what I can with what what blood work I can get. So, this will give you somewhat of a picture of what's going on with me. So, going into how I'm feeling. So, well, first, actually, I want to start with I did so about from weeks 1 to 2, I started to notice, a little bit of libido, started to notice like erection quality getting better. Then weeks 3 and 4, I started noticing nipple sensitivity. And so that tells me I was probably starting to have higher estrogen and probably at risk for gyno. So I had a SERM on hand, which is a selective estrogen receptor modulator. I had two. I had Clomid and I had Tamoxifen or Nolvadex. Those are the two names that it's known as. So I had started supplementing 15 milligrams of clomiphene and 20 milligrams of tamoxifen, and that so far has kept my symptoms at bay, made the gyno go away. At the same time that I was starting to feel the gyno symptoms, I also noticed my libido started to drop. So when my testosterone went up, my estrogen went up, and then I guess I must be estrogen dominant. And like my libido actually started to go down as my estrogen went up. But then I started taking the SERM, and then my libido came back, and the gyno symptoms went away. So if you're going to do this, I would have a SERM on hand. Just a warning. From there, otherwise, how am I feeling? My depression has been going down. Like I'm feeling better. I'm feeling happier. I feel better moods. Feel more thankful for things. Have more drive. Like all in all, in general, I feel better than I have in ever since I've taken finasteride. Finasteride has kept me in a low grade depression and like no drive for so long. Even though I've been working out, eating well, as you saw, my blood work is in good shape. It's not like I don't take care of myself and monitor my health. It's just I just couldn't get myself into a place where I felt better. So yeah, I know it's the HCG, and I'm going to keep on taking it. And keep taking the SERM, which is I take it every day because I want to keep the buildup of the medication to prevent any gyno from returning. But yeah, my erection quality is up, my libido is up. It's easier to get erections, it's easier to maintain them, and yeah, just in general, like everything has been getting better the longer I take HCG. So for me, it's working. I know it doesn't work for everybody, but I will note that it has been working great for me, and it really started to take effect once I started mixing in the SERM with it as well, because I must be an estrogen dominant person in general. And so, I was starting to get gyno. So yeah, that's where I'm at. I'm going to keep on going. I'll come back either a month and a half to let you know where I'm at. Have things gotten better? Have things gotten worse? What my blood work looks like, 3 months out. I'm assuming that my testosterone is going to keep going up because I've read studies that it's really around the 2 to 3 month mark is when you really start to see some even more dramatic improvements in testosterone levels in people that are hypogonadal or have hypogonadal symptoms, which I have or I had. And I feel like those are going away. So I'm super excited. And I'm looking forward to giving you another update in a month and a half to see if things continue to get better. If you like what you hear, hit the like and the subscribe button, and also leave some comments if you like. I'm not going to give you medical advice. I'm always going to tell you to talk to a doctor and consult with them and get your bloods done and everything like that. But I'll try and answer any questions that I feel like I'm in a space to answer in order to help out as many people as I can get past this disorder.